class. Today I will be teaching about the topic ethical and legal aspects in critical care nursing. This topic is for BSc third year. This is from critical care unit. So let's see with the introduction. Ethics have always been an integral part of nursing. Okay, whatever procedures we follow, whatever protocols we follow, there are always ethics behind it. Nurses at all levels or areas of practices experience a range of ethical issues during their day-to-day daily work. Critical care has also come to be associated with high-tech technology, aggressive and often risk-filled medical care. The critical care nurse are often confronted with ethical and legal dilemmas related to various ethical principles, and it has also increased dramatically since the early 1990s. Many dilemmas are byproducts of advanced medical technologies and therapies developed over the past several decades. So there are some principles that we have to follow. The ethical principles are: number one is autonomy, number two is beneficence, third is non-maleficence, fourth is justice, five is veracity, and fifth is fidelity. So first we will so there are some legal issues or ethical issues that are found in day-to-day life of the nurse in the hospital. So first is the informed consent. It implies to informed consent is it is a permission by which the patient to perform an act on his body either for diagnosis procedure or therapeutic procedure. So there are four elements of consent. Okay, there are voluntariness, meaning they are openly voluntary for doing the procedure. Next, capacity. Number three, knowledge and decision making. So those are the elements of consent. So there are two types of consent. One is implied consent, meaning which is written in the forms, okay, and the other is express consent, where you are expressing yourself, your views regarding the consent. So the points to be considered in consent are: the consent must be given voluntarily, meaning should not be forced. If patient is not mentally capable, such as critical patient, then informed consent should be taken from the surrogate or the family member. It should be given by a person of sound mind and above the age of 18 years. Okay, the person who are capable of eligible for consent are above 18 years. It requires disclosure of basic information which is considered necessary for decision making. And patients providing consent should be free from pain and depression. So that is why there should be no forcing of signature. When the consent is invalid, okay, when it is obtained from a minor, that is below 18 years of age, when it is given under fear of fraud or misrepresentation, the consent obtained from the person who is not fit, consent obtained in language which is not understood by the person. Next, consent obtained from person under sedation or subconscious, semi-consciousness or intoxication. The consent which is obtained without providing adequate information on the possible risks are invalid under law. So these are some of the conditions where the consents are invalid. So first is the informed consent. Next is the medical legal case. MLC case or medical legal case is any case where the discipline of medicine comes to the help to help the legal fraternity in its discharge of duties, where the legal family members, they are not able to perform their role, then the MLC, then it will be considered as MLC. The interface of medicine and law is multidimensional and it can be quite complex and perplexing. Healthcare professionals, they have to be very cautious in dealing with a medical legal case. Okay, so because it is related to medicine and law, therefore we have to be very careful in relating to MLC case. So there are some conditions where following cases will be considered as MLC case, and this is to be intimate to the police regarding. We should be informed to the police regarding such case. So number one is all cases of injuries. Two, all cases of burns, then alleged cases of assault, all cases of suspected poisoning or intoxication, Cases which are referred from the court, they are considered as MLC case. Cases of suspected abortion or criminal abortion, cases of unconsciousness or coma where the cause is not natural or not clear, cases which are brought dead to the hospital or death on arrival or sudden unexpected death. Then cases of suspected self-inflicted injuries or attempted suicide. So these are some of the cases of MLC. The important consideration is MLC. They should be notified, should be informed to the police, collection and preservation of samples, recording of dying declaration, etc. So these are some of the cases of MLC. Next, medical documentation is very important, and the proper medical documentation is a legal necessity. That is why in every ward the nurses should maintain proper documentation. A good record should be correct, should be clear, comprehensive, chronological, and contemporaneous. It is a fact that good records are indispensable for proper care and treatment of patients. So records and reports also will have an impact on the improvement of quality of care of the patient. Consent from patients before carrying any procedure is mandatory legal. It is ethical and moral requirement. Similarly, the document once prepared has also to be preserved for a specified period of time, that is 3 years from the date of treatment. Next issue is the use of restraint. Restraints are interventions that limits the person's freedom to move. Okay, it can be physical restraint or chemical restraint. Researchers reported that the use of physical restraint will lead to skin trauma, muscular atrophy, nosocomial infection, constipation, incontinence, limb injury, contractures, depression, anger, decline in functional and cognitive state, and increasing agitation. Why? Because they are not able to move. We do not have the freedom to move. Okay, because they are tight. Because restraints limit movement, they also limit the principle of autonomy. Considering the physical, physiological, psychological, and ethical aspects of physical restraint, it is advocated that such is only used when all other methods of managing the problem have failed. Employed with caution and at last resort, and use least restrictive method possible. So we have to use restraints limitedly. Next, decisions regarding the life-sustaining treatment. Okay, so this is also another ethical and legal issue. Usually, there are two levels of treatment. One is the ordinary care, which is provided to patients, okay, who are not very critical, and the other is extraordinary care, which provides specialized care to life-threatening situations. Then, however, the ethicists, okay, they believe that any treatment that becomes extraordinary whenever the patient decides that the burden outweighs the benefit. First is the cardiopulmonary resuscitation decision. So resuscitation efforts are used to reverse the clinical sign of death. Ethical questions arise on the use of CPR and emergency cardiac care. Like why are you giving CPR? Okay, all these questions are to be filled and monitored. In what situations could resuscitation efforts be used? How long should efforts continue? So these are some of the points that you have to remember, okay, while following the ethical principles. A generally accepted position is that resuscitation should stop if the physician determines the efforts to be hopeless. Okay, so if there is no reviving of patient, then the physician should stop. According to American Hospital Association, healthcare providers may stop CPR when 30 minutes or 50 minutes of advanced life support have been attempted. After giving ACLS, then if the patient is not reviving for about 30 minutes, then the CPR should be stopped. This is in adults, whereas in newborn 15 minutes. Then the do not resuscitate order, DNR. Okay, DNR is commonly followed in ICU. So the DNR order is still not documented legal practice in India. So it is not mostly followed in India, but in abroad countries it is being followed. It is a verbal communication between the doctor and the patient's relative or the caregiver. So do not resuscitate. If the patient, you know, feels that he does not need to be resuscitated when he is about to die, then uh, that is uh, the legal document should be uh, it should be recorded. Next, withholding or withdrawal of life support. Withholding and withdrawal is totally different. Withhold means uh, to never initiate a treatment, means to never ever withhold means not to give it anymore, and withdrawing means stopping the treatment once started. So the distinction between not starting a treatment and stopping it is not in itself of ethical significance. What is whether the decision is consistent with the patient's interest and preference. So withhold, if withholding, I'll give you an example. If the doctor is giving some antibiotic and the patient is having some allergy, okay, then we have to withhold the drug. Withdrawing the drug means that if the patient is not willing to take the medicine, then that is called withdrawing. Next issue is the organ donation. Okay, so despite the success, that is severe shortage of organs, potential donor may agree to donate organs or tissues at any time by signing the donor card. So anybody can donate their organs, but for that you need to have a consent for donation. Okay, that is by the patient, the family, or the surrogate is needed before transplanting team harvest the organ. So before donation also, donating any organ or tissues, the consent should be maintained by the donor and by the family also and the surrogate also. The removal of organs can be accomplished without causing any harm to the living donor, or organ removal are performed only in donor who meets the legal definition of brain death. Everyone has the right to donate their organs and tissues. So there are some ethical issues of the most concern. The 5 most frequently cited ethical issues reported by the nurse surveyed were: protecting the patient's rights and human dignity. Number 2, providing care with possible risk to the health, that is patients with TB, HIV, or any violence. Then respecting and not respecting informed consent to treatment. Staffing patterns that limits the patient access to nursing care, and use or non-use of physical restraint or chemical restraint. So these are some of the common ethical issues that most nurses are facing. What are the ways to resolve ethical problems in ICU or critical care setting? First, you have to gather the facts, okay, the relevant facts, and identify the decision maker and the stakeholder. Then number 2, identify the ethical problems. What are the problems? What are the issues that are facing in the ICU? Then involve others in the process and use consultation resources as appropriate. Third, we have to analyze the problem by using ethical guidance and resources. Fourth, we have to deliberate about the action alternatives in light of guidance and choose one and justify the. So for the action to be taking place also, we have to choose properly, and we need guidance. And last is evaluate the action being taken place and the reflect. So these are some of the ways where we can resolve ethical problems. So I hope this is clear about the ethical and legal issues in critical care nursing. Okay, so thank you, class.